Heel pain is one of the #1 complaints that I get. And the fascia of the foot, which is like a big rubber band running the bottom surface or the sole of your foot, all attaches back in your heel to the calcaneus as the Achilles tendon comes up and wraps into it, and then the fascia wraps into it. There's lots and lots of little fibers there that are attached to the bone structure. When improperly supported or overused for some reason, these fibers can break, they can stretch, they can become inflamed, and this creates heel pain. So to heal that heel pain, you need to stabilize the motion. One of the best things to do is use a custom orthotic that stabilizes the arch and reduces or minimalizes any amount of movement and stretch on the fascia in the first place. Of course, ice therapy is fantastic anytime you're in pain with any body part. Ice, ice, ice. We want to never ever go barefoot while you're healing your heel, because when you go barefoot, it's unsupported, and I just mentioned that support is important. So the only time you really want to be barefoot is if you're in the shower or the bath. And then, of course, you want to stretch the area, because the stretching exercises promote blood stimulation and healing. And then you want to try to use some sort of a night splint apparatus when you sleep. This is really important because when you're asleep, your body sends messages to heal. Well, if that foot is in a relaxed position, that fascia is relaxed and shortened. So that first step out of bed every morning, when you put your feet down on the floor and it stretches out, is going to be very painful. And most people do complain about that first step out of bed. And after a few steps, it goes away. Well, that's because the foot has healed in a shortened position, and that first step just rips it right back out again. So if you sleep with your foot in a night splint apparatus, which means that foot is going to be in a 90-degree angle while it's healing, that healing happens in the elongated state. Therefore, that first step out of bed every morning isn't so irritating, because you've had proper healing through the night. And let's face it, when we sleep is when we should heal. So you want to make sure that you're healing properly. Oh no, shin splints are not first aid. Shin splints are actually a tearing away of tissue from the actual shin bone itself, and this is usually due to a lack of proper arch support. Most of the time when the arch is supported properly, those shin splints go away within just a couple of days. It's amazing the difference. Well, I think heel pain is hard to heal because of compliance and just actually doing what you need to do to heal the pain. Of course, wearing a custom orthotic would also be accompanied with a good supportive pair of shoes. And you know, you're not going to have to wear those shoes forever, because once your heel does feel better, then you can start going into some of the other footwear that you prefer to wear. But if you're going to be on your feet long term and you have had heel pain in the past, it's probably a good idea to do something to avoid it coming back by using proper footwear and staying compliant to your arch supports, your custom orthotics, and staying compliant to whatever it was that helped you heal it in the first place so it doesn't reoccur. Yes, most definitely. Mainly because that's the area of inflammation. And sometimes heel pain isn't necessarily plantar fasciitis. It can be associated with heel spurs, which is a buildup of calcification on the heel bone itself, creating pressure against nerves and soft tissue, which can be painful. It can also be because there is inflammation in general in the body that has to do with reflexology and the reflex points in the feet that go to those other parts of the body that have the inflammation. So when I'm talking to someone about heel pain, I'm going to try to find out what their lifestyle habits are. You know, do they eat well? Are they on their feet excessively? You know, what may have attributed to this that then we can look in those directions for proper guidance for healing.